Illinois taxpayers on the hook for the health care of undocumented migrants in the state of Illinois, and it looks like the state's taxpayers going to be covering that cost to the tune of up to $550 million for the coming fiscal year. That's after a projected cost of more than $1.1 billion. But the governor having some cost control measures that the legislature gave him, he's essentially slashing that in half. And he's getting some criticism from advocates pushing for even more health care for undocumented migrants in the state of Illinois. Welcome back. It is Springfield's Morning News. I'm Greg Bishop on 92.7 WMAY, Springfield's News and Talk. Yesterday, I shared with you a conversation I had with Healthy Illinois campaign, and they talked about the governor's move to essentially say that they need to limit the amount of costs for the migrant health care. The governor announcing that he was essentially going to freeze the program for those between the age of 42 and 64. And you had the Healthy Illinois campaign push back against this. Tovia Siegel, she's one of the organizers, said that grassroots groups are protesting and they're demanding that the governor reissue his decision, reverse his decision to freeze the program for non-citizens between the age of 42 and 64.
Ultimately, we do want all ages, regardless of immigration status, to be covered. These are low-income immigrants. And
that was, an idea that was prompted saying that she wants more of a universal health care of sorts. So the activists and the migrant groups pushing back against the governor, he responded to that yesterday at an unrelated news conference in a couple of different facets. Here's the governor talking in particular in response directly to those who were pushing back against his idea of freezing the taxpayer subsidies for part of the program to subsidize undocumented migrants' health care to the tune of $550 million. Here's the governor from yesterday talking with reporters up in Chicago.
Look, we've all worked together to make sure, and we're talking about the Congress people as well as our members of the General Assembly and everybody who cares about this program to provide health care, to provide this program for 63,000 people in the state of Illinois. And we're continuing to do that. In fact, there's room for a few more within the program and within the budget. Remember that the General Assembly provided $550 million for this program for FY24. That's about $300 million more than we had originally proposed in our budget. That's a good thing, and we need to make sure that we're living within our fiscal limits within the state of Illinois. That's something that wasn't done for a lot of years in Illinois, and now here in 2023 and going into our fiscal year 2024, balancing the budget and making sure that we're paying our bills and expanding and providing undocumented immigrants with health care that's like Medicaid is an important thing for us to continue to do.
So again, Governor J.B. Pritzker doubling down on his desire to increase the program and to ultimately pay for the health care costs, make taxpayers pay for the health care costs of undocumented migrants in the state of Illinois. But he talked about why it's important. Why do this, especially with even pushback from Republicans saying that the overall idea is wrong and there's other priorities the state needs to focus on. The governor, he doubled down and talked about why he's looking to continue doing this. He even uses the term universal health care.
Sure. I think we all understand that if people can get preventative care, that keeps us from spending more money later on, and of course keeps people healthy. And that's my goal. And that's the goal of the Latino caucuses and of the broader community of advocates. Always, when we talk about universal health care, which is something I believe in, that we talk about wanting to do that, but of course we have to do it within the limits of our revenues and making sure that we're balancing the budget. And so this year, as we've now expanded this program through 63,000 people and more that are signing up even now, we're providing that kind of basic health care, right? There's a free doctor visit, there's free pharmaceuticals when people are prescribed prescription drugs, and those are things that will prevent worse health effects that may come from not having that kind of coverage. So we're pleased at the kind of coverage that we're going to be able to provide. Again, we're trying to put it in a Medicaid type framework, which it was not in before, and believe that preventative health care is the best way to go about it. I wish we could provide health care literally for everybody in this country, and we ought to be able to do that. But we need to work toward it ratably every year, as I have as governor of the state of Illinois.
So interesting to hear that again coming from the governor about universal health care. How would that be paid for? I was talking with somebody even just earlier this morning, Mark Cox out of 97.1 in St. Louis. He was talking about the story with me, and he asked the question, if we get to universal health care, how is that going to impact overall budgets? Because think about it. I mean, you're likely paying a private health insurer to give you quality health insurance, and your employer is likely helping provide that. Even state employees have private health insurance that's paid for by the state and by the employees contributing to their health insurance. But when it comes to the Medicaid type programs for undocumented migrants in Illinois, those are all tax dollars. Yes, there will be some kind of copay starting July 1st for certain things, up to $250 for a copay. I believe that's for like hospitalization. But ultimately, the overall costs are going to be paid for by the Illinois taxpayers. And those Illinois taxpayers are not going to get any assistance from federal tax dollars. So that's just the undocumented migrant portion, let alone how much overall Medicaid in Illinois costs, which is billions and billions on top of the $550 million cost for undocumented migrants. So doing universal health care, would that just do away with completely of the option of having private insurance? And what would that do to the quality overall of health care in the United States, let alone in Illinois? So there's a lot of unanswered questions, and it's interesting to see now the trajectory that this migrant health care program seems to be facilitating, and that is what the governor said and what even the advocates are saying. They want universal health care. Fully taxpayer subsidized health care? What would that do to the marketplace? What would that do to the quality of healthcare in this country? I think it's an important question that we should and must postulate moving forward as we see the continued cost of this particular program.